Hello, and welcome to another episode of Boundless Body Radio. I'm your host, Casey Ruff, and today we have another amazing guest to reintroduce to you now. Siobhan Huggins is a returning guest on our show. Be sure to check out her first appearance on episode 656 of Boundless Body Radio. Siobhan Huggins is an independent researcher with interest in cholesterol metabolism, inflammation, lipedema, and metabolic diseases. After meeting our former podcast guest, Dave Feldman, at Ketofest 2017, Siobhan's passion for lipidology was ignited, and she was driven to research all she could in an attempt to figure out how lipids were involved in the immune system and chronic diseases. After losing over 80 pounds, she was referred to a lipedema specialist for a possible diagnosis, which sparked her interest in the condition as a whole and the people that it affects every day. She was finally diagnosed with lipedema in 2021, and she promptly joined the board of the Lipedema Project as a research specialist. She presents at various conferences on lipedema pathophysiology and the mechanisms of why ketogenic diets may be uniquely beneficial for managing lipedema symptoms and progression. She has since written several published articles on many platforms, including on Dave Feldman's Cholesterol Code website. Siobhan Huggins, what an absolute honor it is to welcome you back to Boundless Body Radio.
Yeah, it's so awesome to hear like all of the background and be like, man, there's so much that's changed since I've last been on here. And so today it's not just me, but we also have Leslyn. I actually just gave a presentation on one of our other papers at Low Carb Boca just this past weekend when we're recording. And the way that I introduced her there was that she is a lymphatic black belt. So Leslyn, please give us some more details to what I mean.
Amazing.
Thank you. I haven't had a chance to see the recording of that, Siobhan, but that's very nice. I like that.
That's pretty cool.
I am an occupational therapist, and I got my doctorate that focuses on lymphedema and obesity. And so I have been a certified lymphedema therapist since 2000. And so I've been focusing on lymphatic diseases since that time, treating that as an occupational therapist. And lipedema fell into that also, that a portion of my patients had that. But of course, we've discovered so much more about lipedema, particularly since Siobhan joined us at Lipedema Simplified and a Lipedema Project. So we've just been incredibly active since Siobhan got together with us and really motivated us to get more involved in research. And so the things that we've been finding about, particularly with diet and lymphedema and lipedema, have really grown leaps and bounds, with a lot of other researchers around the world really focusing on this issue as well. So it's very exciting.
Wow. That's awesome. We're certainly grateful that you could join us, both of you. This is such an amazing and important topic. And I've made this point several times where Nicole Laurent encouraged me a few years ago to put in ketogenic as a keyword onto Google Scholar, so it can send you like studies, the latest studies that are coming out. And I half jokingly say it's almost annoying now. It feels like spam, because I get emails like every other day with a huge list of studies that like I just don't have time to go through every single one of these. There's so many coming out on diet alone. And Siobhan, your work really kind of taught me how important this work is, and how it's so like overlooked. And since you kind of talked about the condition, and you talked about how you can look around and identify the condition, I feel like I'm starting to be able to kind of do that as well. And it's such a frustrating kind of topic and condition to have. Can you remind us a little bit about your personal story? And we mentioned a little bit in the introduction, but like we said, like a lot has changed. And yeah, can you remind us about your personal story and why this is so important to you?
Yeah, so in terms of lipedema, I mean, it was kind of a weird journey for me because I had abdominal obesity before I started a ketogenic diet, and that had resolved over the course of the diet, still resolved, thankfully. But then like that weight loss resulted in some disproportion appearing, and it was especially highlighted when I did a 2-week long water fasting experiment, and then some additional fasting after that. And I had posted before and during pictures, so I lost weight over the course of that experiment. But some people reached out to me privately and said, hey, like, have you ever looked into lipedema, because how you're losing weight over this experiment is kind of like leaning towards that. And I essentially said, I don't know what that is. But I did talk to my doctor who referred me to a specialist, and I ended up getting diagnosed. But the other aspect that was really interesting to me is that that doctor, she's a lipedema specialist, and there were these like an entry survey, kind of like an intake form. And it asked about all these questions in terms of pain and all this other stuff. And often, like, there were write-in text boxes for that survey, and I had to put, like, not right now, but before a ketogenic diet, this was a problem, just like over and over and over again. And I still have some issues related to it, so I tend to swell in the heat, and it makes me nauseous, and that's not fun. I do have to be careful about any weight gain because there's more recent research coming out indicating that that can be a trigger for progression. And then, like, that kind of goes into what I've been focusing a lot over the past couple of years, which is, like, lipedema does have these components of the symptoms that are very important. There's the fat gain component, the disproportion, the potential disfigurement, the pain that impacts a lot of people really severely, the swelling. But there's also, beyond that, there's the psychological component of wrestling with having a chronic condition that can make other people perceive you differently because it involves fat gain. That can be really difficult for a lot of people, and it can be really difficult around just trigger periods like pregnancy. Like, there's a lot more women with lipedema diagnosed before they start trying for a family. Some are diagnosed after giving birth, and then it's like, I've spoken to some women who have said, like, I don't want to have children because either they don't want to go through pregnancy and have their symptoms get worse, and that potentially impact their body, their mobility, their quality of life, but then also they don't want to pass it on to their children. So it, like, talking to a lot more women with lipedema has made me focus a lot, especially with the help of Catherine Sayo, because this is, like, within her realm as well, of holistic approaches to address not just the physical symptoms of a disorder, but also look at the psychological impact that that's having, the emotional, how their social life is doing, making sure that they're well supported, and just the spiritual aspect as well, in terms of what is their reason for living, what is their reason for being here, what's their sense of purpose. All of that can be impacted by lipedema. So I've definitely felt some of that too, but also in a positive way as well, because I found such a niche in the lipedema community talking about all of this stuff, including nutrition. And then also the other aspects of the research, like the lymphedema connection that Leslyn and I and other co-authors have been looking at. And it's also hopeful, which is the really awesome thing. There's so much that could be studied and could be done that is so hopeful. Like, we could do a lot of really good stuff in the world, which is awesome.
I would love to have you clarify one thing, Siobhan, because one thing within your introduction was talking about you and interested in lipidology and how that is different from lipedema, because people might think that lipedema, the condition, is spelled Lipid, like lipids. And if you're going to try to Google this condition, you got to spell it correctly. So can you talk about that, the meaning behind the name of the condition and the correct spelling so people can learn more?
Yeah, so lipidology refers to the study of lipids or fats. So that would be triglycerides, cholesterol, LDL, lipoproteins, all of that stuff, which is how I entered the space. But then lipedema comes from the same root, so it also comes from lipids as in fat, but then the component at the end is coming from edema, so swelling or water accumulation. So it's swelling of the fat is where that name comes from. So with lipedema, it doesn't really have anything to do with cholesterol, but it is a condition. It's worth clarifying what it is. It's a condition that affects the fat and the connective tissue, and then there also seems to be some stuff going on with the lymphatics. So it's a very complex disorder. But the basic outline of it is that it nearly exclusively affects women. It results in a disproportionate accumulation of fat, typically on the lower body, but also the other limbs like the arms. And that fat is often painful. So it could be painful with pressure, like let's say you have a cat walking across your lap. That could be painful. For some people, that pain is excruciating. But it could also be spontaneous pain. It could be a feeling of heaviness or tightness in the legs that correlates with a sensation of swelling in the legs. Easy bruising is common, or at least from what we've heard clinically from people working with these patients. And there's no known cure. That's the other aspect. But there is one other aspect of it, which is it tends, the lipedema tissue specifically, so in the lower body and the arms, if they're affected there, it tends not to respond very well to calorie restriction or exercise. But there's been some talk lately about adding an asterisk to it not being affected by diet in general, because it does seem to respond a lot better to ketogenic diets. So I always want to caveat here that even though we say that, like, we do see circumference reduction in the studies using ketogenic diets, but that doesn't necessarily mean it's going to normalize in everybody using a ketogenic diet. I've definitely seen some individuals, you know, their after photo with keto, you wouldn't even guess that they had lipedema. But for some people, you can still tell, but when you talk to them, they talk about how much better they feel, regaining mobility, the pain reduction, the huge improvement in the quality of their life. So it's important to separate those things and understand, like, with this condition, we understand a lot better now that it results in an accumulation of scar tissue within the fat. And that is really hard to get rid of. Whether you're talking about like a joint injury from sports, you can have scar tissue there. Anyone who's worked with that knows how difficult it is. But then the scar tissue in the fat is a whole other beast. There's a lot we don't know about it. But yeah, hopefully that helps clarify.
Yes. And I'd like to also add to the discussion the clarification about the similarities and differences between lipedema and lymphedema. So lymphedema, LYMPH, lymph, and edema, swelling. And you can see how the two conditions are similar, but they seem to have different roots in the causes of them, but they end up getting a lot of the same symptoms. So lymphedema is usually can be caused by some kind of trauma, surgery, a lot of times from cancer treatment. Lymph nodes are removed. You get radiation therapy that damages the lymphatic system. But you can be born with a genetic anomaly where your lymphatic system is not properly formed. And so we start with a fluid overload that is not properly evacuated. But this fluid overload and the lymph stasis, or the stagnant pooling fluid, can cause fat proliferation and scar tissue in the tissue that has the lymph and the fat, giving a very similar presentation of the tissue to what's in lipedema. We start with a overabundance of, excessive adipose tissue that ends up attracting fluid. And so you have edema and you have scar tissue with that. One of the main differences is that lymphedema, if it occurs in more than one limb, it's always asymmetrical. There's always one. So if it's in both legs, one leg is worse than the other. And it will occur also in the foot. Lipedema, however, is symmetrical, and it just doesn't affect the feet typically. And there'll be the same thing with the arms. So the hands aren't affected. But here's where it gets really confusing. People can have lipedema and lymphedema both. And so then it becomes even more challenging to differentiate between the two conditions, because, and then also put on a layer of obesity on top of that. And so this gets very complicated, but to someone who's experienced in lymphatic diseases can help the person tease those pieces apart. And I think someone who's experienced the lymphatic diseases and also has the nutrition piece, and particularly carbohydrate restriction, can really add to that person's quality of life and health. Just as Siobhan already discussed, the impact that this way of eating has on lipedema. Well, we're discovering the same thing with lymphedema, that it has a huge impact on the symptoms and the quality of life of the person.
Yeah, and it's worth mentioning that this kind of came about the reverse way. So originally, you were looking into ketogenic diets for lymphedema,
Mm-hmm.
for lymphedema management, and Catherine Seo came in and said, "Hey, maybe this could work for lipedema." And then you started working together, and I came in way down the line.
Mm-hmm.
So it's actually funny that we're circling back here, but
Yes.
the big thing that I think is worth mentioning is in terms of ketogenic diets, a lot of the discussion has been specifically on lymphedema management. And we ended up writing a paper that came out pretty recently proposing something that I think is fairly novel in the literature. I haven't seen anyone else mention it, which is that potentially metabolic therapies like ketogenic diets could be used for specifically what we were talking about is cancer treatment related lymphedema prevention. So that's a big deal because all of the stuff I said in terms of the psychological impact, emotional impact, social impact, all of that stuff for lipedema, all of that can also be applied to lymphedema because we're not just talking about like, oh, your hand swells a little and you go about your day. We're talking about a lifetime of wearing compression, getting lymphatic treatments, having to be very, very careful about skincare because of the increased risk of cellulitis, so skin infections. And it's a huge emotional toll. I spoke to somebody else. Yeah, I'll just say I spoke to somebody with lymphedema who said that she had cancer treatment related lymphedema, and she said it was, the cancer diagnosis was one thing because she felt like she could go through treatment for that and come out the other side. With lymphedema, it does not go away. So it was very psychologically difficult to deal with that diagnosis on top of everything else. So I don't know. It's something I
Yeah.
had been thinking about for years, and I was surprised that nobody had published this idea before because the other thing is we're already using ketogenic diets for an adjunct therapy for cancer. So why not tack this on instead if we can
Right.
get a group
Right.
where, they have breast cancer or something, and as part of that treatment they're using a ketogenic diet, why not do a long-term tracking to see if rates of lymphedema are lower?
Yeah.
Because it's what, like a quarter of people who get the lumpectomy end up with lymphedema a couple of years down the road. Is that right?
Well, it's so interesting that um, someone could have the identical treatment, same number of nodes removed, same amount of radiation or no radiation, chemo or no chemo, identical cancer treatment, and also have the same profile prior to their treatment. So same comorbidities or lack of comorbidities. And one person will get lymphedema and the other person won't. And that's always been a question. Why did this person get it? They had hardly any lymph nodes removed. They had no other cancer treatment that shouldn't have happened. But everything, as Siobhan has said, they've been studying, okay, you have lymphedema. Now, how do we manage it? And they've been exploring how a ketogenic diet can help you manage it. Because yes, it does. The swelling seems to go down and you lose weight and all these beneficial things are happening. But Siobhan was already thinking about, well, can we stop them from getting it in the first place so that we don't have to lifelong manage it? And so it's our hypothesis that a person's metabolic health going into cancer treatment can predispose them to getting or not getting lymphedema. And so if they already have good metabolic health through good nutrition, then they would be less likely. And so can't we, if they're not already have good metabolic health, they're not already eating good nutrition, can we at the same time of diagnosis of cancer start a ketogenic diet, hopefully before they have surgery or other treatment, and support them in that way, be good for their cancer as well. Start with that and see if, I mean, that we should theoretically keep them from getting lymphedema in the future. That's our hypothesis, and we're hoping that people will be interested in exploring that and doing some research.
Yeah, and it's worth mentioning also that the number of people you would need to track, you'd probably need to track for 2 or 3 years after, do some follow up on them, because lymphedema is not something that occurs immediately after. people can be diagnosed and start seeing worsening symptom over the course of 2 years after the intervention that triggered it happened. But the number of people you would have to follow is not that many. You could have 100 people and still get a decent signal because it happens so frequently. Again, I think it's something like a quarter, 28% or something like that. It depends on which people you're looking at, of course, but let's say you take high risk people, people with metabolic syndrome, people who are overweight, and then you track them. I think you'd be able to get some good data on that with only, say, 100 people or something like that.
Now, we already know that there's a super high correlation between someone who is obese and goes through cancer treatment and someone who is not obese and goes through cancer treatment. The person who is obese is sometimes 9 times as likely to show up with lymphedema. So there's lots of substantiation out there that our hypothesis is a good one and should be investigated, because it is, as Siobhan said, this can be a horrendous impact on someone's quality of life. I've had many patients, since I've spent 25 years treating these conditions, many patients have told me that the diagnosis of lymphedema was more horrific than the cancer diagnosis, because, as Siobhan said, this is lifelong. You always have that inkling in the back of your head that my cancer is going to reoccur. So that is happening, but it's this constant daily, sometimes many hours per day, having to manage the lymphedema that sometimes really can impact your quality of life. Just thinking about that can be damaging.
Yeah, and I don't know. I just think it's worth studying. It's worth doing. And there is I can see some pushback come from this of saying, okay, you're talking about somebody just diagnosed with cancer and you're encouraging them to do something else on top of everything else, navigating the treatment plan, really just confronting mortality on that level, and then asking them to do something else. But I think that argument it doesn't treat patients who've been diagnosed with cancer with the level of respect that I think they deserve. Because, I mean, I've seen a lot of examples of people diagnosed with cancer and they're immediately looking for what they can do. They want to have some agency over their care and over their long-term outcomes. And, I mean, I've seen the same argument with things like diabetes or anything like that of, you know, they don't want to, they want the easy route. And I just don't think that's true. I think there's a lot of people who, if you tell them, we don't know if this is for sure, it's something we're investigating, but look, this is a low risk, potentially high reward option if you want to explore it. Here's some resources on that. Here's, you know, the thinking behind why this might be helpful. If you want to try it, go ahead. If you don't want to, no problem. I think a lot of people would do that because, I mean, some people are caught completely off guard and they had no idea that there was anything that they could do to decrease the risk. And like Leslyn mentioned, the risk factors are manageable. They're things that you can do something about. It's obesity, it's metabolic syndrome, it's hyperinsulinemia, all of this stuff. And then even beyond that, one of the things we talk about in the paper is that there are mechanisms where ketogenic diets in particular might be beneficial because of the ketone exposure that you have.
Yes.
So then there are other options you could also explore. I mean, for one, there's a lot of people doing ketogenic diets for cancer because of the work of Thomas Seyfried. So they might be getting that anyway. But also there could be studies into could exogenous ketones be helpful here as an additional boost on top of lifestyle intervention. There's just a lot of stuff. So in terms of those mechanisms, like we've seen it in mice, and there's some preliminary data which might be suggestive of this happening in humans. But in the mouse study, exposure to beta hydroxybutyrate, blood ketones, encouraged lymphatic vessel regrowth. So when we're looking at lymphedema, we're seeing injury to the lymphatic system and issues with productive regrowth. So I've seen it described in some papers as organ failure of the lymphatic system. And we've already seen examples of ketogenic diets beneficial in other cases of organ failure of the same kind of sequence of events. So heart failure, chronic kidney disease, fatty liver that results in fibrosis of the liver or scarring of the liver. there's a lot already there, and it's like it's so ripe for the picking.
Mhm.
And
I would like to just circle back to your comment about patient agency, or the person who's now has a condition a disease that they need to deal with, respond with. They need to be given all the choices. Unfortunately, we have healthcare providers that are making the decision for the patient and not telling them about all the choices. So I think that the patient may decide, no, I'm not going to do anything with diet. Just give me a pill, give me a surgery, and let me go that route. Fine. That was their decision. We cannot take that decision away from people by limiting their exposure to all the options that are out there. So I think I see it in my field as well, because sometimes lymphedema can be a very expensive condition to manage. There are compression garments that can be thousands of dollars that a person may need to manage their condition. That would be the optimal garment. But there are some healthcare providers that think, oh, this person is financially strapped. I'm not even going to tell them about that particular garment. There's this cheaper version. It won't do as well, but it'll be, they can financially take care of that. You're just taking that choice away from the person. You have no idea what other resources they have, or what other capacity they have in order to take the optimal option. So what Siobhan and I are saying is just let people know, and then they can decide.
yeah, and we see this exact same thing with ketogenic diets as well, of people with diabetes, people with obesity, all this different stuff, not being told about ketogenic diets because it's presumed it'll be too expensive, too hard, too time consuming, not sustainable. I have a friend with epilepsy who she brought up a ketogenic diet with her provider, and she was told, oh no, that's not sustainable. And what they were recommending was brain surgery to treat her seizures. Like, I'm sorry, what does sustainable even mean? Sustainable is made up of multiple different components. It has to be pleasurable, it has to get easier over time, it has to be within your means in terms of time and budget and all this stuff. But ketogenic diets are endlessly adaptable for sustainability, endlessly personalizable for people. You can eat at fast food restaurants and be on a ketogenic diet. I have seen long haul truckers on ketogenic diets. I've seen people with no money at all do ketogenic diets. I've worked with people like that who on shoestring budgets pulling this off with other conditions like ADHD or depression or all sorts of different things, still pulling it off. So I think like we have to believe in people that if they really want to do something, they can pull it off. And of course, if they have limited means or barriers, the expectation should be either you will help them get over those barriers or you'll connect them with resources to help them get over those barriers. So patient advocacy groups, peer support groups, all sorts of different stuff. There's free ebooks and articles and all sorts of stuff on how to deal with these, but I just don't think it should be an excuse. Like we have to talk with people about this, and we have to get the research done, because again, like if we can prevent lymphedema in these patients, and even some of them, like let's say we brought it down from 1/4 to 12.5%, that's a big deal. That's a lot of lives that are impacted by that. And it's something that is, again, low side effect, low risk, potentially high reward, and it's already been researched for cancer treatment in terms of safety and efficacy there. So I don't know, I just want to get the conversation started, and I think there's a lot more research even that we talk about in terms of things that we don't know. So we're definitely not saying that we have all the answers either. There's stuff in relation to impacts on low oxygen levels in the tissue and the immune cell response and stuff like that that could be impacted. We don't really know, but I think there's enough to go on that at least warrants a little bit of exploration.
Yes.
Wow, that's super important. Thank you so much for explaining all that. I really appreciate it. And I agree. We've already mentioned her, but Nicole Laurent, something she said will always stick with me, is she's dealing with mental health issues. And she'll get on stage and say, like, anybody who's suffering with mental health issues, that's already a challenge. What you're doing is already tough. It's already tough to take these medications and suffer through what you're suffering through. A ketogenic diet is not going to be more difficult than what you're already going through. You'll have to make some changes and it'll take some time to get used to, but you can do this, and what you're doing is already very hard. So yeah, I love what you were explaining, Siobhan. And yeah, thank you so much for explaining the differences between lipedema and lymphedema. They can definitely get confused with each other. Tell us about this latest paper. It really just came out. I think you sent it to me just a few weeks ago. Tell us what the aim was, what your ideas were, and how you were able to pull this off.
Yeah, so it came about. Oh, well, what happened is that Leslyn was talking to somebody else, someone who's had this experience with cancer treatment-related lymphedema. And why don't you tell that portion, Leslyn, because I was not there. I came in later.
Yeah, she was thinking about, I was someone who did not have a weight problem. I always did things to try to keep my weight down, and typically exercising like a maniac and eating super low fat and super low calorie and plant-based. But still in her 20s was diagnosed with melanoma. And that was scary. She went through the surgery, did not have to have any other treatment. Did not have chemotherapy, did not have radiation, and they only removed a few nodes out of her groin. She almost immediately developed lymphedema in her leg. And her BMI was like 21. I mean, she was doing the recommendations of what was told to us to eat, a plant-based diet, which is essentially a very high carbohydrate diet. So she thought she was doing everything correctly and her weight was good. Why her? Well, when she decided to further look at this, after she had had lymphedema for another 20 years and was managing it daily, she started looking at, well, maybe I'm what they call TOFI. What does that stand for again, Siobhan?
Thin on the outside, fat on the inside. So
right. And so she
levels of subcutaneous fat, below the skin fat, but potentially high levels of visceral fat and fat around the organs, basically.
And that's what she was thinking, that even though she had an appropriate BMI, she was metabolically deranged. Is that a connection? Is that why she got lymphedema? Her doctors never even told her of the risk of lymphedema, because he told her when she showed up with lymphedema, her surgeon said, "You're too skinny. You never should have got lymphedema." So I didn't bother to say anything to you about it. So now she's, I think now 30 years dealing with this. And so we started this discussion of what the link between metabolic derangement and lymphedema. And so pulled in a couple more people, and we decided to write a paper about this hypothesis that what if we can offer this to people so that they can go into cancer treatment metabolically healthy, not only help with the cancer, but may prevent lymphedema, a lifelong condition, keep that from happening.
Yeah, so essentially in the paper, we outline what are the risk factors to developing lymphedema, just to get a scope of like what kind of thing are we dealing with. And then we even dive deeper into what is going on at the tissue level and the microenvironment. What are the things that we can see that's going on in terms of low levels of oxygen availability, inflammation, the fibrosis developing around the lymphatic vessels? What are the best thinkers in this space thinking is happening with lymphedema, which is really, I understand the comparison with organ failure. It's more of a location-specific organ failure, so it's probably not, in most cases, the entire lymphatic system is failing, but a portion that's been damaged failing. And you see that exact same stepwise occurrence of you have this initial insult, you have the inflammation going on, you have improper repair, you have the fibrosis, and then eventually the failure of the actual function. And then you start seeing more of that fluid accumulation in just this, I don't want to say self-perpetuating, because I think there are interventions you can do to help a lot. But something that, if not intervened with, self-perpetuates and gets worse and worse and worse, because there's a lack of ability to self-resolve in the environment that they're in. And so then we also look at, like, are these things changeable? Are these things aspects that we can intervene in? So the metabolic health of the person on the macro level. But then, even if we can't necessarily increase the level of oxygen, are there things we can do with the tissue to make it more resilient to low oxygen levels that happen with that injury? And there are. So, for example, ketogenic diets have been studied for, I've seen it recommended in an older paper saying any condition that relates to hypoxia, as long as there's some oxygen, ketogenic diets might be helpful, because the ketones, you get more energy for the same amount of oxygen usage. So that helps with the tissue resiliency in that circumstance, because one of the big issues with low levels of oxygen in a tissue is you can't generate the energy you need. So cells start dying, they start becoming damaged, become dysfunctional, all this stuff. So we dive super deep in, and I think we got it to a pretty good level. And one thing that I really like about it is I really encourage people to read it, not just because we want people to start thinking about this and looking around them and seeing what can we do with this information to explore this idea further, but also we included an analogy throughout the entire paper to help it be more understandable to the layperson. So we have this analogy of a house that has water damage that's accumulating, and how to think about the tissue in this way of when you're in an improper environment, when the body has trouble dealing with all this other stuff, and then you add on one more insult to it, how that can affect the repair process. So I think even if you're not familiar, I won't say it's easy to follow, but we did our best to make it something that clinicians and patients and everybody who's interested in can read. And I just think it's worth exploring, it's worth thinking about, and it's worth talking about.
Yeah. It is interesting that the research that has been done on lymphatic diseases like lipedema and lymphedema and diet is for lymphedema, because we can make an animal model that it is an animal model of lymphedema, then we're studying animals. And there's been very little done on humans with lymphedema using a ketogenic diet. In the case of lipedema, there's no animal model of lipedema. And so they, fortunately, I think, went straight to humans. And so there's been a huge amount of studies, clinical trials, and some randomized clinical trials on lipedema and diet, on a ketogenic diet. And even though researchers really started on lymphedema, there's so much more translational research that is done on humans for lipedema, but I think we can extrapolate on the huge successes that we've had on lipedema, that this can also have an effect on lymphedema, even though it's been very little. I mean, I did a pilot study that was published in 2017. That was the first time anything had been done with a ketogenic diet and lymphedema. That was the first one. I had 10 people in that little pilot study that showed the exceptional response. And then there was just recently, the latest one was, I think, 7 people in a Belgian study about lymphedema and a ketogenic diet. So we just don't have that much on lymphedema, except a lot of animal studies. Well, you could control what animals eat a lot more than we can control what humans eat. So even though we're asking them to use a ketogenic diet, we have no idea what they're actually doing. But even with that, even with the limited stuff that we have on humans and lymphedema, it just seems incredibly powerful and really very promising.
Yeah, and let's say we want to do a transitional step. Let's say we're not quite confident enough to, say, intervene at the cancer diagnosis level for whatever reason. I feel like there is a mid-step that we could do, which is lymphedema does take a long time to develop, and there are those earlier signs of the initial swelling that gets worse. So maybe we screen people for that and then say, hey, it looks like you could be at risk of developing lymphedema based off of this post-treatment swelling. Let's see if we can put you on a ketogenic diet and see what happens. And again, like, if we see a lower rate than we would expect, maybe we start walking it back from there. Because with epilepsy, for example, that's what they did. They went with the more conservative approach of, if they're not responding to drugs, we'll start them on a ketogenic diet 12, 13 drug tries down the road. But now they're starting to walk it back, introducing it in pediatric epilepsy as a first line response, and getting a lot of good response there, to the point where they can start them on a ketogenic diet, keep them on it for maybe a year, and then in some cases take them off again and they don't need it anymore. That's the other thing with this too, is, even if we did do it at the diagnosis level, we're only talking about really during that vulnerability period. They can continue it afterwards, however long they want. But this isn't saying that necessarily they have to stay on a ketogenic diet for the rest of their life to prevent lymphedema. With lymphedema, there's this vulnerability period of 2 years after the insult. Maybe we keep them on that for 2-3 years and then take them off once they're out of it. I think a lot of people could be open to doing that, and
yeah, but it is, you can end up with lymphedema 20, 30 years after you had your cancer treatment. And I think it's probably because that person is, a lot of factors, but I think a big factor is metabolic derangement. Mm-hmm. And maybe they become more metabolic deranged as they age. And so then lymphedema finally shows up. But Siobhan is right that the majority of cases seem to happen in those first couple of years after your cancer treatment. After your surgery, it's very common to have just some post-surgical swelling that is generally not termed lymphedema because you don't have the fibrosis and all that kind of stuff happening yet. That should resolve, but if it persists longer than 3 months, we start thinking you might actually have lymphedema. Why not, treat it well before that? Why should we wait until it happens till we're really sure of a diagnosis before we have an intervention? At least offer it to the patient so that they can decide.
Yeah, so I think with this, there's just so many tracks you can take depending on how confident you feel with it, all the way from initial cancer diagnosis all the way up to we think this is happening. People are already doing it for management. And I think the main thing to what Leslyn and I are both speaking about is we just need more research, and patients need to know that this is an option, with the caveat that we don't know for sure. This is a hypothesis paper. We're not saying we know for sure. We repeatedly state there's tons more research that we need, but again, low risk, potentially very high reward. Just mention it, have them read the paper, and if they decide to do it, the worst thing is it doesn't do anything.
Yeah, no, that's such a good point. Where are we at with case studies, for example? Like we always talk about, the N of 1 is the poorest form of evidence that we have. Of course, it matters the most for the person who is the N of 1. They're certainly grateful for that research because it's them. Where are we at with case studies? Are there enough case studies to say, like, obviously the two of you are fairly confident in, the hypothesis, but do we have enough case studies to make a really convincing case there as well?
Well, interestingly, one of our co-authors, Dr. Christy Kesslering, did publish a case study that she had a patient who had lymphatic injury to her central lymphatics, which was causing a leak into her trunk. And she had to have that fluid drawn off on a regular basis. And then they were going to do a fairly extensive surgery that may or may not work. Because she was having to come in and have the fluid drawn off, every month or so. And she also was overweight and felt like she was metabolically deranged. So she actually went to Dr. Kesslering because, well, I know you do a ketogenic diet with your patients. Guide me on one as well. So can I do that with you? And they did that. I think with there was other people with her on that paper that was helping with this case. And the central lymphatic injury resolved. She was scheduled for that surgery, a pretty drastic surgery, and they no longer needed to do the surgery because they were no longer having to draw fluid off of her trunk. And so that is a pretty strong case study. And I think that we need more of those, case studies to be out in the literature so people can see that, because it may be a while before we can actually get that clinical trial to do what we want to do. But you're absolutely right, Casey, that we should be publishing these case studies.
Yeah.
Wow, that's so interesting. Siobhan, before we jumped on, you actually mentioned a second paper, which I was completely unaware of. Do you mind highlighting that as well?
Yeah, for sure. So the other paper that Leslyn and I and an additional co-author, Carrie Reedy, worked on is, let me see, I had the title up. It's a therapeutic carbohydrate reduction. Let me see. I should have had it pulled up already. We'll get it for the show notes, but it is a therapeutic carbohydrate reduction for lipedema, guidelines for a patient-centered holistic approach. So this is a fairly hefty document, but for good reason, because we cover a lot of information. I am super excited about it because I've never seen a document like this for any condition, and I would actually like to see more of them. But essentially, it's talking about if you're going to implement a carbohydrate reduced diet for lipedema, specifically for lipedema management, here's some things that you have to consider. So here's the psychological factors that they might be facing. Here's the emotional factors that they might be facing. Here is the social type of aspect that they might need to go through in terms of potlucks and parties and just navigating all that, making sure that they have the social support. And then also here's the specific recommendations for what that ketogenic diet should look like. So we talk about some of the things that Carrie Reedy has seen, that Leslyn has seen, even that I've seen in the community, in terms of sometimes there are food sensitivities that have to be looked at. The amount of carbohydrate reduction can vary depending on the person, how metabolically healthy they are, how severe their lipedema symptoms are. Those kind of come in and work together to figure out maybe what they want to shoot for, or if they're just ready to jump right in and they're like, I have a lot of lipedema related pain and I want to fix it like yesterday, maybe they want to go more towards a ketogenic level or a carnivore diet even, just to get that immediate relief, and then they can kind of play around and see what works for them. But I mean, we talk about protein minimums, kind of the shift between carbohydrate and fat levels in the diet. It is a lot of information, but one thing that's really cool is if there's, let's say, a metabolic health practitioner who really wants to help patients with lipedema, they're familiar with low carb, but maybe not the specifics of what lipedema entails, they can read through this and get some strong foundation to start with. And on the flip side, if they're a lipedema specialist and they want to help somebody, but they're not as familiar with the low carb side, they can read through this and get a foundation for, what is a ketogenic diet? What kind of monitoring do you want to do? What are some concerns that you might have heard about with the ketogenic diet that maybe don't fare out with more recent research? And even, someone has a general health practitioner that doesn't know about either end. They can also read this and get a solid foundation.
Yeah, we also talk in there about common comorbidities associated with lipedema. They tend to have hypothyroidism, other various conditions. Well, how does that impact what you decide for the specific foods that you would avoid or encourage that still allow the level of carbohydrate restriction that they would like? So it brings in all those factors, very lipedema specific factors, but also just general health and general human factors. So it's a very comprehensive paper. For that reason, it's kind of long, but it has a lot of good information in there.
Wow. Okay. So you stole the question from me. That was perfect. I was going to ask, this sounds like, yes, it's very specific to people with lipedema, but also there would be a lot of other general information that anybody could benefit from.
I think so. Yes.
Yeah. Wow. That's amazing. The work you're doing is just absolutely amazing. And I'm a little bit siloed in the low carbohydrate space. The conferences I go to, it's what I listen to, the people I talk to, we're all kind of, we're on board. I think I know how these types of studies are going to go. We've seen so many, great results with all kinds of stuff with ketogenic diets in the past. I'm in. I'm all in with all of this. For people that are not all in, or maybe people that are in the lipedema sphere that maybe have not heard about ketogenic diets or the mainstream medical, when you're presenting at a conference like that, how is this being received in the greater lipedema or medical world?
Oh, well, I've been to 2 of the World Lipedema Congresses, and part of the reason I really wanted to work on this paper was when I went to the first one, I was surprised because pretty much everybody there agreed that ketogenic diet should be used for lipedema. This is
Wow.
not controversial. The
Wow.
controversial
And I should
aspect-
have the caveat that most of the attendees and presenters were they were from Western Europe. It seems to be very well accepted in that part of the world, and a little bit more hesitant in other parts of the world.
Yes, definitely true. But at least at the Congress, it wasn't controversial to use ketogenic diets. What was controversial was whether they should be used long term, whether that's safe, if there's risk for kidney disease because of high protein, or fatty liver because of high fat, or all of this other stuff. And I was surprised when I went there because I got in some pretty passionate discussions, let's say, with some of the people there to say, you know, we have a lot of this research already in other conditions, not lipedema specific, but I mean, we have Verta Health data, we have studies on reversing fatty liver, we have studies on chronic kidney disease improving, mild chronic kidney disease improving, and that level of improvement correlating with the level of ketones in that person. And it was not completely siloed, but there was some missing context that I definitely saw, and that's part of why that's in this paper is, hey, in case you're not caught up on absolutely everything going in the ketogenic world because you have a life, you're focused on treating patients, you're over in the lipedema world, here's some stuff that you might want to know. But there are so many awesome people. There's a lot of lipedema specific physicians who have lipedema clinics who are utilizing ketogenic diets in their practice and have been doing so for, I mean, some of them over a decade, long time, and seeing really good results.
Can I mention our virtual conference that's coming up in April?
Yes.
Because Siobhan and I and our co-author from that paper, Carrie Reedy, we are in charge of the program for this virtual conference is coming up April 17 to 19. And it's called Kind and Gentle Low Carb Nutrition for Holistic Healing in Lipedema and Lymphedema. So I'd love for that to be part of your show notes that we can show people how to register. If a practitioner or a person who has one of these conditions, this is for you. It's going to have lots of information about how to implement this diet and the benefits of this diet can be for those conditions.
That's amazing. Yeah, we'll be sure to add that in the show notes. Siobhan, I just have to say, I feel so badly for whoever tried to engage you in a passionate discussion. I would not want to have a passionate discussion with you. You're way too smart for.
No, she was so kind. She was so kind. And she didn't say the end part of that is that person came back to the next conference and he had been, I would say, partially convinced because of Siobhan's way of presenting the information, because she is so kind about it, but she's very scientific about it.
Yeah, so it was during a panel discussion, someone had brought up, hey, do we need to be worried about ketogenic diets and their impact on kidney health? And that same person I had talked to the last time said, we actually have studies showing that there can be improvements in kidney health on ketogenic diets. And they kind of position, maybe they're not so worried about it anymore. So, yeah, I mean, that's what a lot of this is just starting the discussion and acknowledging nobody can know everything in every sphere of knowledge. We really do have to build those bridges. I know Peter Bowerstedt talks about that a lot, but with every condition, in just making sure everybody has access to the wealth of information that's available.
Yes.
Yeah. Wow. Well, building bridges is a perfect segue to the last question I wanted to ask you, which do we need to study more? Yes. Do we need to know more and have conclusions? Yes. Is that going to take some time? Of course. It's going to take some money. Of course. We're not going to get these answers tomorrow. We're going to keep pushing, and you certainly both are making it happen out there. For somebody who is, recently diagnosed with this, or for practitioners, I think each one of you can speak to this. What would you want somebody to know? Somebody who's diagnosed, who's confused, who is not getting the answers in the medical system, or a practitioner who is out there trying to help people and is not making any headway. What would you want people to know and walk away from this conversation with?
I mean, I think part of it is just that they can reach out to us. We're very accessible. We're happy to talk about it. Any questions that they have. This is part of what I talked about at Low Carb Boca in terms of lipedema. If you don't know how to do this, but you want to help, we want to help you. So just reach out. We're happy to hop on a Zoom call or whatever it is that you need. And the way that we get this research is we have people trying it, and then they are transparent about what their outcome is. So the case studies come from people and practitioners who try it, patients and practitioners, I should say, who try it, and they see some sort of result and they think it's interesting and they publish it. We need more of that happening here, because that can really help the people who organize the trials to say, this is something we should really be researching. And I know it's been a big discussion in the low carb space in general. I know it takes time and effort and a lot. It takes a lot, but it helps so much. It helps build up that resource base and that information database for other researchers to come in and pull from. Maybe they have a PhD they're working towards and they need something, and they say, this is perfect, I'll study this. That's how it happens. So a lot of community collaboration, and part of that is, if you need help, reach out and we're happy to chat.
Leslyn, anything to add to that?
I would hope that our emails will be associated with in the show notes, because I'm happy to respond to emails. And then, as Siobhan said, we might jump on a Zoom meeting when someone needs a little bit more help and support. Siobhan and I love talking about this and discussing it with people. So I would just encourage people to reach out. You got questions, comments, you want to know where to get resources, contact us. We'd be happy to talk with you.
That's absolutely amazing. Yeah, that's absolutely amazing. I don't know many medical professionals that would be willing to share their email for anybody just to email them at any time about something. So I really appreciate that. This has been an amazing conversation. I really appreciate all the incredible work that you're doing. Siobhan, I think the point you made earlier about the emotional impact and the psychological impact on something like this can be really challenging. And so to be making headway and to want to get the message out there, again, to the extent of like wanting to share your email is absolutely incredible. Excuse me, I'm so grateful for both of you for taking the time to be on our show today. Siobhan, I'll start with you. Where do you want people to go to find you and connect with you and your work? And of course, we'll link all of this up in the show notes so people can find it as well. And then Leslyn, we'll go to you.
Yeah, so like we just talked about, we'll put my email in the show notes. You can often find me associated with my volunteer work with Lipedema Simplified. I'm always doing stuff there. We have weekly Facebook Lives and monthly webinars and all sorts of different stuff going on. 2 events per year focused on lipedema. And then also another thing worth noting is that we do have a lipedema textbook coming out next month. I am one of the co-authors on one of the chapters in that, talking about the holistic approach for lipedema. So definitely check that out. It's up for pre-order on Amazon. We'll put the information in the show notes. But then also I'm often at low carb events, so you can find me there. I'm either attending, speaking, or I'll often be at the Own Your Labs booth. So yeah, you can find me in person and online, and also on Twitter. I'm on Twitter. It's at Siobhan_Huggins. We'll put it in the show notes so you don't have to try to spell it.
That's amazing. Leslyn, last time I had Siobhan on, she listed off like about 10 minutes of places that you could find her and things she's working on. I teased her by saying, that's it. That's all it is. And she went out for like another 2 or 3 minutes with more stuff. Yeah, no surprise. Leslyn, for you, where can people go to find you, connect with you and your work?
A lot fewer places. I don't even know how to use the Twitter, Instagram. I don't know what all those things are. But I also can be reached through, I have a couple different emails, but the Lipedema Simplified website, you can find me there. And then my email will be down below. It's through Lipedema Project. I also have my own website where I talk about lymphedema and lipedema and ketogenic diets, and that's at leslynkeith.com. So I think those are the main places to get a hold of me.
Also, we should mention, Leslyn has multiple books that she has written, one of which is awesome. I mean, both of them are awesome, but I really, really like and recommend The Lymphatic Code. So if you're interested in lymphatic disorders and metabolic therapies like low-carb and ketogenic diets, go check that out. It's awesome. There's like a Sherlock Holmes kind of idea carried throughout the whole thing, and it's so fun and informative, and I learned so much from it.
Oh, thank you, Siobhan, for saying that, because I always completely forget.
That's amazing. So many resources, like we said, we'll tag everything up in the show notes. But for now, just so incredibly grateful for both of you doing amazing work. And this is going to help a lot of people. So thank you so very much for all the amazing work that you do. And thank you so very much for taking time out of your busy schedules to be on our show today. We really appreciate both of you.
Yeah,
Thank you
for having us on.
Yeah, of course. It was such an honor. And this has been another episode of Boundless Body Radio.